Okay, let's look next at this research study about because we were talking about the atherosclerotic or the hyperlipidemia effects. And so in this research study, they're looking at the mechanisms. How does berberine actually reduce the risk of the development of atherosclerosis? And so there's multiple different mechanisms. You can see through one is through the serum lipids. So this is the cholesterol, right? So its effect here is that it helps to lower total cholesterol, lower triglycerides, lower LDL-C, increase HDL, which is good cholesterol, and then it also helps with the cholesterol efflux, and it reduces cholesterol uptake. So multiple different mechanisms of action, but this is just one. So this is on the fats or on the cholesterol molecules themselves, but then it also has an impact on endothelial cells, and that is it reduces inflammation, it reduces the death of these cells, reduces oxidative stress, and it can improve NO production. NO is nitric oxide, and nitric oxide is a powerful vasodilator, so it helps these blood vessels expand and dilate. This is actually one of the things that contributes to blood pressure regulation, because when your blood vessels can't properly expand and dilate, the pressure goes up. And again, berberine has an impact on the production of nitric oxide to the positive. We also know that there are additional things that occur with macrophages. These are types of white blood cells that lead to inflammation and the plaque formation in the arteries. So this, you can see here that berberine's effect with macrophages is it reduces inflammation, reduces foam cell formation. Foam cells are what really line this area in here and begin that formation of plaquing. So again, berberine reduces foam cell formation and increases autophagy. We also know that it has an effect on the vascular smooth muscle cells, reducing proliferation and migration. We know it has an effect or an impact on the platelets, so it reduces platelet aggregation or platelet clumping, and it inhibits thrombin, or rather it increases thrombin inhibition. So thrombin is necessary for clotting. It's a protein made that helps with clotting, and so again, this is one of the impacts of berberine, is that it actually kind of has an anti-clotting effect, or a blood thinning effect, if you will. Now we also know its impact, as I've mentioned a moment ago, with the gut microbiota and dysbiosis. I mentioned that berberine increases short-chain fatty acids. It also improves or reduces the formation of TMA and TMAO. This is trimethylamine. This is a compound that can alter cells in the GI tract and has the potential to change these cells into precancerous cells. And it also increases a type of bacteria called Akkermansia. Now, if you've been following along for any length of time, Akkermansia is a type of bacteria that's highly been touted, and it's been being pushed a lot, especially online. If you look at a lot of the nutritional commercials coming online are about this particular type of bacteria for its aid in diabetes and for its ability to help with potential help with weight loss. So again, berberine increases this particular species of bacteria. So a lot of science behind the potential helpful impacts of berberine. Let's talk about a few more studies. So this one was on the study of berberine hydrochloride in the prevention of colorectal adenoma recurrence. So in this one, they took 1,100 adults aged 18 to 75 who had had at least one and no more than 6 confirmed colorectal adenomas. In essence, they had colon cancer. This was a 3-year study where they used berberine and compared it to a placebo. And the dose was 300 milligrams BID. And again, that's not as strong of a dose as we've seen in some of these other trials, but that's approximately 600 milligrams per day of berberine over a 3-year course of time. And so what they determined, berberine at that dose was effective and safe. The risk of the recurrence of colorectal adenoma or colon cancer was reduced in this trial. So we know that in this case, it had impacts on cancer. Now, one of the suspicions as to why it impacts or can have an impact on cancer has to do with its ability to arrest cell cycling in cancer cells. And so if you look here at this study, it says berberine acts as an anti-cancer option by inducing apoptosis, in other words, helping cancer cells recognize they need to kill themselves. And then as well, you can see over here cell cycle arrest. So it stops their cell from replicating, influencing something called mitogen activated protein kinase, and also influencing transcription regulation. So the inhibition of carcinogenesis, cancer creation, is also combined with lipid metabolism, and we know berberine has its impact on lipid metabolism as well. So again, these are some of the mechanisms behind why berberine has this anti-cancer effect. You see here, berberine is a plant alkaloid possessing scientifically determined mechanisms of the prevention and development of atherosclerosis, type 2 diabetes, as well as obesity and cardiovascular complications and cancer. It positively contributes to elevated levels of fasting, stimulates glycolysis or the breakdown of glucose. It improves postprandial blood sugars. It improves glycosylated hemoglobin while decreasing insulin resistance. It also improves insulin secretion and inhibits gluconeogenesis and adipogenesis in the liver. Okay, lots of things there. You can also see that the alkaloid exhibits an anti-inflammatory property by stalling the expression of this enzyme here called COX. Now, if you don't know what COX is an enzyme cyclooxygenase, and it's present in your cell membranes. So your cells contain a bilayer of phospholipid around the outer layer, and inside that bilayer you have an enzyme called COX. So when a cell is damaged, this enzyme is released and it starts to drive the inflammation process. So when you have something that inhibits this enzyme, COX enzyme, if you have something that blocks it, that's an anti-inflammatory effect. Now, COX is also inhibited by things like aspirin and ibuprofen and drugs like Celebrex. Or naproxen. So if you've ever been put on an NSAID, a non-steroidal anti-inflammatory drug, these drugs are basically COX inhibitors. And so that's an impact of berberine. It has a natural COX inhibition effect. We also know that it affects the prostaglandin E2 production, and again, this also plays a role in the inflammatory cascade. We know that berberine is neuroprotective, and it acts as an antidepressive. However, the outcomes in psychiatric patients are nonspecific. It has been shown that berberine improves metabolic parameters in schizophrenic patients, acting as an adjuvant during antipsychotic treatment. One of the things too, if you know somebody who's taking a drug for schizophrenia, one of these powerful one of these powerful antipsychotics, is many of them increase blood glucose. So a lot of the drugs used to treat schizophrenia increase blood glucose and increase the risk of developing diabetes. And this is again one of the things they're finding out about berberine is because its impact on blood glucose, it actually has an adjunctive effect. So if somebody's being treated for schizophrenia with a powerful drug like Geodon, for example, berberine has an ameliorative effect on the blood glucose side effects of that medication. But okay, so going back to cancer, we've got berberine over here we said was effective at reducing the potential for recurrence of colon cancer, and that, again, that's a human study. And then we have here Berberine ameliorates cellular senescence and extends the lifespan. Now, this is an animal study. This is an animal study, not a human study. We don't have human studies yet, to my knowledge, on berberine expanding human lifespans, but we know it can do it in mice. And so if we look down here at kind of the synopsis of this study, is that berberine extended the lifespan of chemotherapy-treated mice and naturally aged mice by 52% and 16.49% respectively. The residual lifespan of the naturally aged mice was extended by 80%, from 85.5 days to 154 days. That's tremendous. The oral administration of berberine in mice resulted in significantly improved health span, fur density, and behavioral activity. Therefore, berberine may be an ideal candidate for the development of anti-aging medicines.